Hi, good morning. My name is Jose Miranda Velasquez. This video is for BSN 225. This is going to be an administration of medication, the ophthalmic medication, where we administer the eye drops. So for this video, I'm going to be using this vial of medication to simulate my medication I'm going to administer. I need 2 sets of clean gloves, tissue, and a washcloth, along with my hand sanitizer for hand hygiene. I have my Nightingale scrubs with my batch. We're going to go ahead and get started. Uh, so for this medication, or for this administration of medication, I need to verify my doctor's orders for this patient. Uh, Once I've verified that, I need to verify my 6 rights of patient administration. So from there, I want to make sure that I have the correct patient, the correct medication, the correct dose, the correct route, the correct time, and the correct documentation. After I had verified and checked uh, everything, I want to make sure that I had verified and checked the medication with the EHR. For this particular medication that we are using, the doctor prescribed Timolol 0.5%, and it's 3.4 milligrams per milliliter. And the order is to drop 1 drop in each eye twice a day. So for this skill, there is no dosage calculation that is required. The medication itself in the vial is already prepared and ready to go. So from there, I need to verify my medication with the MAR. I need to verify that it's all of 3 different times before I can finally administer the medication to the patient. So I would verify it at this point, which would be verification number one. Once that is verified, I would gather my supplies and make my way towards the patient's room. I would knock, enter, and I want to make sure that I close the curtain or the door behind me to ensure patient privacy and to avoid violating any or to avoid any HIPAA violation. I set my supplies down on a clean, dry, flat surface and perform hand hygiene. Uh, I would introduce myself to the patient and then basically go from there. So, hi, my name is Jose. I'm one of the nurses here. Can I have you state your name, your date of birth, and medical record number if you know it? And as the patient is doing that, I want to make sure, and I want to check the patient's bracelet or wristband to make sure this is, the information matches, and I have at least my at least 2 patient identifiers. From there, I would continue. So, Mr. Miranda, hi. Like I said, my name is Jose. I am one of the nurses here, and before I get started, I do have a few questions for you. Uh, are you allergic to anything that we are not aware of? No, perfect. Okay. Uh, well, to continue, if I have any more questions, at this point, I would look on the computer and then I would get the medication itself and check that again with the MAR to make sure that this is who this is intended for. This is who this is. This is a medication for this patient, right? This is the second verification, second step of the verification, or the second time that we verify. Okay, Mr. Miranda, I'm here because the doctor ordered you to have this ophthalmic medication. It is an eye drop medication, essentially. You are receiving this medication. It is, or you're going to be receiving. It's called Timolol, and the doctor wanted you to have 1 drop in each eye twice a day, and it's intended to help with your glaucoma. Okay. Okay. I do want to point out a few things, Mr. Miranda. This medication itself is a beta blocker. It's meant to reduce the intracranial pressure in your head and the pressure in your eye, which is, I guess that's what helps with the glaucoma. And I do want to let you know there are some effects or side effects with the timolol. It is common to have blurred vision. It is common to be to have sensitivity to light, and it is possible that you may get a headache. So, and if any of these start, if any of these persist, please let me know. With every side effect, there are some adverse reactions that could happen We don't want this to happen, but if it does, please immediately let me know, so that we can let the doctor know and get that taken care of. Those adverse reactions that we do not want are possible chest pain, if you start to have shortness of breath, if you start to feel any swelling in your face or your tongue or your throat, let me know immediately. Uh, I do want you to know that I will be with you throughout the whole process, throughout the whole step. I will check on you after I administer the medication. Um, but please do let me know if any of these symptoms start to happen, uh, or if you feel like they're going to happen. Most importantly, before that, let me know before it's too late as well. Let me know immediately. Also, I wanted to point out that this particular medication, well, it goes in the eyes. You will feel some stinging, some burning in your eyes. Not excruciating, you know, burning or stinging, but it is going to be there. There is some stinging, some burning, and just wanted to make you aware of that essentially. Okay. Any questions for me, Mr. Miranda? No. Okay. I'm going to check my computer really quick, and then we're going to go ahead and get ready. Is that okay? Perfect. At this point, I would check my computer. I would check my medication with the MAR. This would be my third verification to make sure this is who it's intended for, to make sure everything is correct. Once I have verified that, I will go ahead and perform some hand hygiene. I'm going to get my gloves, put them on, and then proceed to talk to Mr. Miranda here. Okay, Mr. Miranda. So for this medication, uh, just want to let you know, it's ideally we would like to lay you down flat if we can, and we'd like for you to tilt your head up so that we can instill the drop in your eyes. Um, Ideally, it's what works better. Uh, we want to make sure that the medication itself goes into your eye, and so I want to let you know that I was going to lay you down supine. Okay. So at this point, I would go ahead and proceed to lower Mr. Miranda down supine. I'd raise the head of, or pardon, the entire bed up to me, the gurney, and then I would lower my rail. I want to make sure and check with Mr. Miranda to make sure he's comfortable. Mr. Miranda, you are laying flat on your back. Are you comfortable? Yes? Okay. From here, I want to really quick explain to Mr. Miranda that I'm going to be cleaning his eyes to make sure the medication goes into his eyes and he has a clean set of eyes prior to the administration. So, Mr. Miranda, I'm going to be cleaning your eyes, okay? I'm going from the inside out. So, what I would do is I would take my washcloth and I want to start to clean the eyes. I want to start at the intercanthus and work my way out. I don't want to scrub and I don't want to press down on the eyeball. I don't want to give it any additional pressure. So I take my washcloth, take my dominant hand, put my non-dominant hand on his head, and then clean from the intercanthus out on one eye. Take a different portion of the washcloth, and I'm going to do the same thing from the intercanthus out. I would at this point take my washcloth and discard it. So with the washcloth, want to make sure it has warm water, uh, something warm so that if he does have anything stuck to his eyes, any what we call eye boogers or anything that's dry, it's easily dissolvable. I don't want to scrub. I just want to make sure that it comes off naturally if possible. Okay, Mr. Miranda, uh, your eyes are clean. Uh, I cleaned out both eyes. So from there, now that my washcloth's disposed, I wanted to, well, that's already taken care of. So I already let Mr. Miranda that his eyes are clean. I will go ahead and move on to the medication portion of, uh, you know, the procedure. I would go ahead and remove my gloves, throw those away, perform some hand hygiene, and talk to Mr. Miranda. Let him know, ask him more than anything if he's still comfortable. Mr. Miranda, are you comfortable? Yes. Okay. At this point, I just want to remind Mr. Miranda that it is going to sting. And, you know, as I'm talking to Mr. Miranda, let him know we don't want him to blink or close his eyes. So, Mr. Miranda, just a reminder, please don't blink or close your eyes. Uh, if you move and we miss, we have to administer the medication again. And then when we administer the medication, what I want to do is put the medication in your conjunctival sac and not in your cornea. And I'm going to be pressing down on your cheekbone to help open your eye up. Uh, so from there, once I've explained to Mr. Miranda what I would do, is once I've explained to Mr. Miranda what I'm doing, I would go ahead and take my non-dominant hand after I don my gloves, and I want to use my dominant hand itself to hold the bottle, and my non-dominant hand to hold the cheekbone of Mr. Miranda. And I want to bring the tip of the bottle, as close as possible, but I do want to point out that I need to be 1 to 2 centimeters away from the sac itself, and I can drop my little droplet there. Okay, my gloves are on. I have my medication in my hand. I have my medication in my dominant hand. Take my tissue in my non-dominant hand. Okay, I would take this portion here, press down on Mr. Miranda's cheekbone, hold it down, bring my vial, my bottle, bring it close to where I see the sac, and administer my 1 droplet of medication. I don't want the tip to touch his skin. I don't want it to touch his eye or the sac. I need to be 1 to 2 centimeters away. So once uh, the medication is in, what I want to do is take my tissue that I used to hold down his cheekbone, uh, and what I want to do is, well, first and foremost, sorry, I'm getting a brain fart here. Once I've administered the medication, I take my tissue here that I just used, and I would discard that. I don't want to use it again. What I want to do is take a new tissue, and I want to hold down on the lacrimal duct and uh, apply pressure to it, and hold it down for about 30 to 60 seconds. This would ensure and instill that we prevent any of the side effects. Uh, we're losing Mr. Miranda here. We want to prevent the side effects, and we would do so for the 30 to 60 seconds. For this particular video, I'm not going to do it for that long. Um, Once I've administered the medication, hold the pressure, I toss that tissue, and I'd have Mr. Miranda blink. So, Mr. Miranda, go ahead and blink for me. Perfect. There you go. How are you feeling? Perfect. From there, we're going to go ahead and move to the other eye. So, what I would do is take another tissue, go ahead and grab my medication again, go ahead and press down on the cheekbone, locate the lacrimal, or pardon, the sac, the conjunctival sac, administer my 1 drop. Okay, once my drop is in, I take that tissue, discard it, and take another clean tissue, and then I would hold some pressure on the lacrimal duct for the 30 to 60 seconds. Okay, go, Mr. Miranda, go ahead and blink for me. Perfect. All right, Mr. Miranda, how do you feel? Okay. So once I've administered my medication and I asked Mr. Miranda how he's feeling, give him a moment to kind of adjust his eyes, have him blink. I ask him how he's feeling, make sure there's no side effects, make sure he's not feeling anything abnormal. I would go ahead and ask Mr. Miranda if he's feeling any complications or any of the symptoms that we discussed. Uh, so, Mr. Miranda, any complications? Are you feeling anything abnormal? Anything you'd like to let me know about or that we talked about? No? Okay. I'm going to go ahead and sit you back up. So at this point, I would sit Mr. Miranda back up, either Fowler's or semi Fowler's or whichever he is comfortable with. I would bring the railing back up and lower the bed. At this point, I want to make sure that Mr. Miranda is comfortable. And, well, sorry, I want to make sure he's comfortable. Mr. Miranda, are you comfortable? Yes? Okay. So, what at this point I would do is I would take my medication, take my tissues along with my gloves, discard everything, dispose of everything, toss everything in the trash. I would finish the procedure, get the patient comfortable. Well, procedure's finished first and foremost, but what I meant was get the patient as comfortable as possible. Uh, Bring the call light to him if he doesn't have it. Bring it to the bedside. Uh, Make sure I want to make sure that before I do anything else, that my medication's closed, the lid's on. Uh, that way, it's good and still clean for the next use. I would perform some hand hygiene, grab whatever's left of what I brought in, grab the medication first and foremost, and bring that with me. I would go and document my results if I can in the room. If not, I would exit the room, close the door behind me, and document the results right after, and then put the medication away. Okay, perfect. Thank you so much. That was my video.